Deaconess was founded in 1892 by a group of Protestant ministers and laymen who felt called to take care of the ill. More than 125 years later, Deaconess healthcare system continues to provide high-quality health care with a compassionate spirit, just as our founders envisioned. Deaconess Health System is the premier provider of healthcare services to 26 countries in 3 states: Illinois, Kentucky, and Indiana. The system consists of 7 hospitals located in southern Indiana: Deaconess Midtown Hospital, Deaconess Gateway Hospital, the Women's Hospital, the Heart Hospital, the Orthopedic Hospital, and the Neuroscience Hospital, Deaconess Crosspoint, and Health South Deaconess Rehabilitation Hospital. I interviewed Karen Peak, the head of the P&R department.
I'm Karen Peak, and I'm the Patient Experience Officer here at Deaconess. I've been here about 17 years, and I've managed several programs, including surgical weight loss and the patient relations department. I have always been interested in communication here, so I do a lot of that with the clinical staff, non-clinical staff, and about their interactions between themselves and patients, and reducing anxiety. From Evansville, so I lived in Chicago for many years, up until about 2000. My parents were getting elderly, so I moved back here to help them. They were in their 90s. And so my background was very different. I actually worked in the film industry, so I thought, where can I transfer that here? But I also have an education in teaching. I taught high school for several years. So I started, I had a nephew who worked here, and so I applied with the education department. They hired me, and I really enjoyed it. I didn't know I would really like hospital work, but I really do love it. I love the communication. I love working with the clinical staff, the housekeeping staff, the dietary staff. Everybody's really wonderful. They're all very patient, family-focused people. So it's just especially Deaconess, just a very, very, very good place to work. One of the projects that I've been working on this year, something different, is our 125th anniversary celebration. And we started back in 1892. There was only one other hospital in Evansville. So there was a group that decided in Evansville that we really needed another hospital. And the word deaconess comes from our very first nurses. They were called deaconesses, and they were also part of a religious order they were nurses, but they were also almost nuns, what we would think about today. So they came down, and they were known for their compassionate and caring attitude toward the patients and families, and that's kind of been what we have been doing over the last 125 years. So this has been a great year of celebration.
Deaconess started the year?
It started in 1892, and it started with a group of Protestant clerical people who had identified this as a great place, this area, to do the hospital. And so they brought some of the deaconesses down from Chicago who were trained to do nursing. And so we started with a few nurses. We expanded from one building to another. One is kind of the interesting things that I saw when I was looking at how we performed medicine, or practiced medicine back then, was that surgeries were often not done in the hospital. They may come to your house and do the surgery on a table at your house. So kind of interesting how far we have come, fortunately, since those very early days. You know, I have probably 70,000 visits a year to our emergency department. So that's a lot. We have a very good way to triage them now, whether they're come in with a cold or a cough or the flu. That's be much more efficient with that type of person. And then so they may go to one area. Someone who comes in with a trauma or an accident may go to another area. So we're pretty efficient with that right now. Caring for the patient, not just in their physical problems or their any other challenges that they have. We also want to treat them with respect. And so that's one of the areas that I work with. Not that we don't have respect, but sometimes we get very involved in getting them emergency medicine, but we also want to deliver it in a caring and compassionate way, because really that's half the battle that we work with. Think about that first hospital we had in 1892. We now have 8 hospitals. And this is Midtown, where I worked at, in Gateway, which I'm also there. We have the Women's Hospital, the Heart Hospital, Cross Point, the Health South Rehabilitation. Those are all ones that you're familiar with. We also help with Gibson General Farrell Hospital in Illinois. We also, this last year, we opened the Linda E. White Hospice Center, which is a beautiful new building on campus here, named after our CEO who just retired. So those are, very great areas. We have many more things happening out at Gateway. So if you go by there, you'll see a lot of building, some new structures going up. So we've been growing a lot. Just in these last 10 years, it's pretty amazing. We have 71 locations, and those locations are from the clinics. So you may be driving along, you see a clinic here, a clinic there, but we have so many demands and requests for clinics to come to different neighborhoods and different areas. And so we've been doing that. The clinics have grown exponentially over the last 10 years also. And we have over 600 providers, which is, that's a lot of doctors and a lot of physician's assistants. And so we have a very large hospital system now.